Okay, can you say something again?
Okay, good afternoon, dear colleagues and ladies and gentlemen. Can you hear me well? Can you hear me?
Very good. Okay, wait a minute. Very good.
Okay, okay.
We are going to introduce you now, Professor Kanno.
Okay, all right.
Hello. Let's begin our lunch seminar section. And this session, we are grateful to have Professor Kanno. Professor Kanno graduated from School of Dentistry of Gung Dental College, and he later on had a PhD degree. And he studied abroad post-clinical fellowship in Gung Maxillofacial University in Munich, and later on University of Bern in Switzerland. Currently, Professor Kanno is Professor and Chair of Department of Maxillofacial Surgery in Chang University. And today we welcome Professor Kanno. Professor Kanno, please.
Yes, thank you very much for your kind introduction, Frank. Okay, so I'm Takahiro Kanno from Shimane University Faculty of Medicine. It gives me a great pleasure and honor to be able to speak to you on my current clinical work on feasibility of a bioactive osteoconductive bioresorbable plate system for maxillofacial reconstructive surgery. Can you see my slide well, Frank? Is that okay?
Yes, very well.
Yeah.
Okay, thank you very much.
Please proceed.
All right, thank you very much. Let me begin my talk. I'd like to divide my talk into two parts today. In the first part, I'd like to share with you the current pros and cons of the commercially available first to fourth generation bioresorbable systems. I summarized 5 years ago in Journal of Dental Science Review. And in current practice of maxillofacial, craniomaxillofacial surgical procedures, we can use 4 generations of plate systems. The first generation is the oldest one, and the second generation is the next. And today, I'd like to share with you the feasibility of the third generative plate system. That is bioactive osteoconductive bioresorbable system. So that's quite very feasible for our craniofacial bone. Date back to the first generation that started 1980s. You know, the monopolymer plate system based on PLLA, polylactic acid plate system. The plus is the resistant to hydrolysis and complete loss of strength within the first 2 years. But it's very old-fashioned. Maybe you Taiwanese do not use anymore because this first generative system has some problems, such as foreign body reactions, inflammation, and late degradation tissue response. So we used to use this first generation plate system, but there are no advantages so far. Then after that, in 1990s, as you know, the second generation system. That system includes the copolymer of PLLA together with PGA, polyglycol acid. That means the resorption time is so fast. So about less than 1 year, 12 months, that can disappear. But what is the cons? Cons is the insufficient intensity. So this system is only applicable in midways. We sometimes still use the second system. Then, the year 2003, the Japanese Teijin company produced the innovative plate system for the world. Third generation plate system that has the osteoconductive, bioactive procedure, bioactive feature. And there are so many pros and also radio opaque. So it can be evaluatable after the end of surgery using CT or X-rays. But what about the cons, disadvantages? The first disadvantage was the long-term resorption time. It needs more than 5 years to be resolved. But still, this system is very, very useful for our oral and maxillofacial surgical procedures, such as reconstructive surgery, OGS, orthodontic surgery, and the bone graft or bone augmentation and trauma, midfacial trauma cases. And since 2019, the Teijin company produced the most up-to-date plate system. That is the 4th generation system. So PGA was added to the 3rd generation. So thanks to the addition of PGA, that can be resolvable much faster than the 3rd one. But we are doing some clinical and animal studies, but we need some more evaluations to conclude that this new 4th generation system is better or not compared with the 3rd generation plate systems. We often use this system for mid phase. But you know, thinking of mechanical strength property, the biodegradable plate system versus the conventional standardized titanium plate systems. There's a very interesting study done a long time ago, but still the bioresorbable plate systems have much weaker strength in tensile test. So compared with the titanium plate systems, the tensile test, according to the tensile test, the strength is about only 1/3 to 2/3. On the other hand, torsion and bending test, the much weaker. According to the torsion and bending test, it ranges from about 20% or 15% to 40 to 50%. So of course, compared with the titanium plate systems, the plate strength, tensile, and the torsion bending properties are much weaker than that of titanium plate systems. But still, for our Japanese maxillofacial surgical procedures, we never use titanium plate systems. Only complex craniomaxillofacial trauma cases, we use the such kind of standardized titanium plate systems. But bioresorbable plate systems are much more superior to that of standard titanium plate systems. since 2007, the Teijin company that produced this third generation UHA PLLA plate system for craniomaxillofacial lesions. And they have already produced many prevent anatomically formed plate systems, and these are very, very useful and feasible for especially orthodontic surgery. The Teijin company has the patent, the multi-axial crystal orientation reinforcement system. So that means the UHA, the unsintered HA, can be uniform structures in PLLA. So this is very, very useful for especially orthodontic surgery, midface and mandible. Of course, I did so many studies prior to the clinical application, especially thinking about the feasibility in OGS. We tested, started from animal study to the clinical study, and also we proved the mechanical strength and feasibility for the use of orthodontic surgery using the in vitro models. So this plate system is the excellent system for OGS. Not only the feature of mechanical property, but also the bioactivity. I also did many animal studies using my PhD students. So commercially available plate systems are only advertised by the company. But before the usage of this kind of commercial available system, in my principle that we always try the experimental studies before the application to the clinical use. And many publications we did, and the feasibility of this Japanese innovative Teijin company products was already published in many by many studies. Other than the OGS, I often use this plate system for orbital reconstruction because this plate has the osteoconductive bioactive property together with the excellent mechanical property, mechanical features. So for orbital reconstruction, I do many orbital reconstruction surgeries in my clinic. And this plate system is very feasible and useful. And I published many papers in terms of orbital reconstruction using this plate system. Just quickly, I'd like to show you one case. 17-year-old Japanese boy got injured during baseball practice, self-hitting. And then the huge orbital defect from the orbital floor to the medial orbit. And then consulted with the ophthalmologist, and the oculocardiac reflex and astral phenomenon were noted. So I planned the orbital reconstruction using this third generation plate system, using the navigation assisted standard procedure. So pre-op and post-op, this plate system has an excellent features for orbital reconstructive surgery. So this is the best feasible application of this plate system. Yeah. Then I would like to go on to the main theme of this lunch seminar. This was required by the US Society and the Chang Memorial Hospital and also from the Teijin company. So my main topic is about the application of this third generation bioactive osteoconductive plate and screw systems for orthodontic surgery. So what is the pros and cons? I'd like to focus on this topic. This is Frank. We met 4 years ago in Singapore because we are all AOCMF members and directors. And I have many Taiwanese OMS friends and Taiwanese plastic surgery colleagues I have known since that time. And of course, for the past 10 to 20 years so far. So just quickly, I'd like to show you the real actual surgical procedures of this plate system, the application of third generation bioactive resorbable osteosynthesis system for OGS. The patient was 23-year-old female patient, the class 3 dental facial deformity with anterior open bite case, and a bit long face type. Yeah. My surgical simulation was LUFO1, segmental LUFO1 fracture, LUFO1 osteotomy, posterior impaction by 4 mm and anterior downward repositioning by 3 mm. Together with the bilateral sagittal splitting layers osteotomy for mandibular setback and genioplasty, reduction genioplasty with the some advancement. So just I'd like to show you my surgical procedures.
Fracture of the maxilla. Okay.
So this the first LUFO1 down fracture was performed and the posterior bone was removed. Then the down fracture was
Operation was
performed.
followed. Then the pterygomaxillary
Yeah, disjunction was followed.
operation was
Then I performed the pyramidal osteotomy
pyramidal osteotomy. Then the
around the descending palatine artery in the bezels. Yeah, pyramidal osteotomy was performed bilaterally.
So pyramidal osteotomy was performed like this.
For the
This part,
posterior impaction of the maxilla.
artery and bezels can include it.
Yeah, posterior impaction. Then, of course, the nasal septum was also
Good.
also
So now
removed.
LUFO1 down fracture with the posterior impaction. Yeah, can be easily performed.
So without
Now it took 30
Yeah.
minutes.
and then the posterior maxilla was impacted, and then together with the anterior
So the
downward,
palatal side is also osteotomized there.
anterior segment was osteotomized using the piezo and the oscillating saw. So anterior canine to canine lesion was downwarded. Then this is the third generation plate system.
Drill. Irrigation. Here.
So drilling, and this is
Then
one more
tapping.
step compared with that of titanium plate system, but
Then-
we need the tapping. Then screw was
これ
inserted.
ね、削りかすが出るからね、洗わない。Then, okay.
So prevent plate is always useful.
Segmental osteotomy, LUFO1, two segmental osteotomy.
This took about 1 hour because I have more than 3,000 OGS cases so far, and it's very
Segment.
standardized osteotomy. Then I performed the bilateral sagittal splitting layers osteotomy. Then for the mandible,
Bicortical fixation.
bicortical fixation using the
Right.
this third generation bioactive
This is the
osteoconductive
automatic
plate screw.
modern device.
Then now the Teijin company produced this kind of
Can you support me?
automatic.
That's
Automatic.
the role of refractors. Otherwise, I cannot do
Automatic
the instrumentation.
tapping device. The Teijin company has already produced that. This is an excellent device.
This screw is above and this screw is below.
Yeah. And then the bicortical screw was inserted to fix the sagittal
No difficulty.
sagittal splitting.
Okay. And now one more above and
Then
canal.
the
This is the osteosynthesis. Yeah. Good. Canal. This is the osteosynthesis. Yeah. Good. Okay.
So most cases, I put 3 screws on the above the mandibular canal and the 2 below the mandibular canal. Then we move on to the genioplasty. So this was the reduction genioplasty. So I moved by 4 millimeter. Then the
一回止めてください。はい。
and the segment was advanced. Then
So this is the last clip.
this third generation bioresorbable bioactive plate system is always excellent to fixate the genuine segment as well. Yeah, tapping procedure is a bit time taking, but not so difficult.
Good. So the reduction and the advanced genioplasty was completed. Okay. Okay. So this is.
Yeah, the operation time took less than 3 hours for the double jaw and with genioplasty, and total blood loss was only 50 millimeter.
So now I fix the all fixation. So I check the occlusion. Then this is the CO, and then the canine to canine occlusion. Very good. This check is really important. Yeah, this is the occlusion, the CO, and yeah, the no immediate occlusion is confirmed. So now the ID.
Yeah, this is the end of the surgery. Because in my department, there are so many ODS cases, so I do not operate so often, just my residents are doing. But for this video, I took these surgical procedures. This is very easy operations. So this is 1 month post-op, and she is now very happy. And then, of course, the plain radiographs, we cannot see any plates and screws. But if we take CTs using the CT window, we can sometimes descript the plate and screws. So the completely same as the pre-operative simulation. So these third generation plate systems are very nice. I have only 10 more minutes left, so I'd like to introduce my up-to-date new surgical techniques. Maybe that would be of interest to your active Taiwanese plastic surgeons and maxillofacial surgeons and oral and maxillofacial surgeons. So I published these techniques already, so I would like to share with you. You know, the transverse collection is very important. Most active plastic surgeons, craniomaxillofacial surgeons, and us oral maxillofacial surgeons, we do the segmental roof-one osteotomy. Of course, because we are active surgeons, so we can do. But why do you not try the transverse collection for mandible? That's much easier. Because my boss taught me this technique long time ago, 20 years ago. And that's the sophisticated technique. And I published a paper this April. So for the collection of transverse discrepancy, of course, it depends on the cases. But if the maxilla is the normal and the mandible is smaller than that, the mandibular widening or mandibular constriction is very feasible. So I just would like to show you my new techniques for transverse collection. So after the end of bilateral bioagnostic surgery,
now the mandible was free, and this is the Nami chodai. Okay. ここにちょうどぴったりは。Good.
the mandibular midline was additionally osteotomized.
Good だね。
Then this technique can be applicable simultaneously with genioplasty. Then
now the mandible was
the mandibular width was widened.
5 pieces.
Then the occlusion was restored
Adjust the occlusion.
using the wafer, surgical wafer. Then this third generation plate system is excellent
Now
to fix
after
three-dimensional shape.
fixed
is always applied to the this kind of mandibular midline osteotomy for transverse collection together with the
Thank
genioplasty.
you.
A bit time taking, but almost the same as the titanium press systems.
Irrigation.
So irrigation is really important during the tapping and the screwing. That reduces the
Good.
friction.
So now
Yeah.
the mandibular widening a little bit, and the mandibular angles were constricted a
Yeah.
little bit. So the now adjustment of the transverse maxillary, and now occlusion completed. Then I just fix the proximal segment to the CL position from now. Okay.
Yeah, when we perform more than 4 millimeter mandibular widening, of course, the mandibular angle is always ostectomized. If the maxilla is small transversally, of course, this is the very standard technique. But standard technique is also not so difficult. But yeah, most surgeons do not apply the mandibular midline osteotomy for transverse collection. This is quite easy standard procedure, right? For the adjustment of transverse
It's a very important point.
collection by using the maxillary midline osteotomy to widen
Now I touching.
the maxillary widening to adjust the mandibular and bimaxillary arches. This is also not so new, but I just wanted to introduce and share with you the transverse collection by the midline osteotomy on the mandible. This is the not so interesting maybe for you. This is very standardized technique for maxillary transverse collection.
It's very easy.
Then always.
So now the maxillary widening is performed, and then the maxillary impaction of the right side by 3 millimeter is the bioactive rate.
Then, as I showed you, the everything is fixed, fixed by third generation osteoconductive, bioactive, bioresorbable plate system.
Biogeneration plate.
This is the case of maxillary widening. The previous one was the mandibular widening case.
This 3 millimeter impaction. The maxillary widening is also completed. That's very good.
Yes, due to the time limitation, I need to summarize my talk. Already 30 minutes have passed. So let's think about the up-to-date systematic review and meta-analysis. The bioresorbable plate system versus titanium fixation in orthodontic surgical procedures. I would like to conclude that no statistical significant difference in terms of stabilization and the complications between two groups. This is the systematic review study and the meta-analysis that concluded during the past couple of years. And also in decision making, most surgeons still prefer titanium plate systems because they are inexperienced. But we Japanese surgeons prefer the bioresorbable plate systems more than that application of titanium plate systems because we do not need to remove the plate systems, and that plate systems have the only osteoconductive and bioactive characteristics. So this is much advantage than that of titanium plate systems. So please let me conclude my talk for the aesthetic and functional orthodontic surgery procedures for dentofacial deformity patients. As I introduced today, and I shared many of my scientific evidence and clinical experiences, this third generation bioactive osteoconductive bioresorbable osteosynthesis system could be an optimal and feasible for modern OGS. But as you know, all our maxillofacial surgeons, craniomaxillofacial surgeons like you, we always have to think about function and aesthetics. And they are all inseparable, indivisible, two sides of the same coin. So always we have to think about the tailored and patient-specific harmony to each OGS case. So thank you very much for kind listening. This is my team in Shimane University. And if you have any chances, could you please visit my clinic in Shimane? Thank you very much once again and kind listening. Thank you much, Frank.
Kanno, we are still here. Anyone have any questions for Professor Kanno?
Any question, comments? I'll be pleased to answer.
Yeah, I would like to answer one question. Do you the surgery, if you do that, no, you don't need INN. Professor Kanno, can you?
Yeah.
Yeah. Do you
Can you
need
see my face?
creative intermuscular fixation? INN.
What did you say? I can't hear you well. Excuse me.
I think it's
Intermuscular fixation. Do you need that?
In the maxillary dissection, maxillary upward or
fixation.
infection.
I am fixation. Fixation. I am
Fixation.
Which wise?
Maxillary fixation.
Yeah. Do you need that?
so I was gonna type
Intermuscular fixation. Which
Fixation.
wise? Yeah. For
This-
4 weeks or 6 months. 6 weeks.
6 weeks for what?
no mouse. It doesn't move. I don't know why.
Intermuscular fixation. With wires.
I was gonna type to him.
Which
Here.
Do you need
Okay,
that?
type it to him. I don't think he can hear it.
Many
Type.
people are speaking at the same time, so I can't catch your question. But you mean the at the time of maxillary fixation?
Yeah, we pass you a message.
Intermaxillary fixation? No, never. Why do you
yeah.
need the intermaxillary fixation? We do not never apply.
Okay.
No. It's mechanically strong enough, so we never applied intermaxillary fixation after the end of surgery. In
And
any cases.
Yeah.
the multiple transcortical screw, how many transcortical screw do you need?
Thank you very much. That's a very important question. I first tried 3 screws each, but sometimes the 1 screw is unstable, then 4 screws, and now I haven't published my data, but the 5 screws are most stable. So I always apply 5 screws each on at the time of sagittal splitting lamest osteotomy.
Okay, thank you. Any questions from audience?
I think Dr. Yang.
Dr. Yang.
Yes. One question for you.
You can use this.
So about the surgical indication, patient, what I'd like to lead the patient selection or post-operative care. Thank you very much. The about the surgical indication, what do you mean by post-operative care? Do you do differently if you use bioplates compared to time? Thank you very much. But 95% I apply bioresorbable third generation, this white colored osteoconductive bioresorbable systems. If the patients would like to do sports, contact sports soon after the surgery, I apply titanium plates, but only 5% or less than that. Almost all the OGS cases are surgically treated using this third generation bioresorbable system, because this is excellent. And also the price is the same for Japanese patients. But of course, for the resident education, we need to educate my younger residents using the standard treatment, using standard fixation and drilling and screwing using titanium plate systems. So this is a very difficult point.
Okay, any other questions? If not, I would like to, if no any questions, I would like to end this section. Let's thank Professor Kanno again.
Thank you very much, Frank.
And
We are going to, okay.
The committee has one certification for you, so we will send to for you. Thank you so much.
Thank you very much. Yeah, I'm looking forward to seeing you all next time, face to face. Thank you very much.
Yeah, please. Thank you.
Thank you. Wonderful time. Bye.
Thank you.